Welcome, everybody, to this week's episode. We really appreciate you joining us. This podcast really shows us how we can all learn, live, and thrive off of each other. By sharing our knowledge through our conversations, we will impart some knowledge whilst learning ourselves how to progress even further. Here is your host.
Now, if you're looking forward to Disruptive Mindship podcast episodes, the focus on self-development and personal development, Laurie and Omobola Stephen is a podcast you like to listen to. Today, I have Laurie Singer on the show with me today, who is a licensed psychotherapist, a board-certified behavior analyst, and also an author. Welcome with me, Laurie and Omobola Stephen, Laurie Singer.
Thank you for having me on today.
All right. Thank you for joining me on the show, Laurie. Now, Laurie, you'll be talking more on cognitive behavioral therapy as it relates to mental health. Now, that's a really big topic we'd like to have on the show. Now, I'm looking forward to a really great and inspiring time with you on the show going forward. Laurie, I'd like you to tell me about your own personal tragedy because you were motivated by it. Like to share more light on that?
Yes. So after I had a 2-year-old son that passed away of cancer, and after he passed away, I went back to school. And at the time I had a 5-year-old daughter, and going back to school, I wanted to help the families because when I was in the hospital, I could see how a lot of families were suffering. And going back to school was very enlightening for me. Because I was never a good student when I was younger, but I was able to use the skills that I had for running events, and I applied that to my study. And I did that. And I wanted to further my education, and I went into graduate school. And while I was in school, I attended therapy, and I went to therapy for the first time. And going to therapy, I was confronted with a lot of different situations that I had shoved down inside of me and never dealt with. So for the first time, I was actually dealing with the death of my son, dealing with the fact that my mom was an alcoholic and drug addict and left our family. And shortly after that, and I think it was even just walking out of one of the sessions where I experienced my first panic attack. And my therapist, she used cognitive behavioral therapy, but it was only in her office. It was practicing the breathing and, trying to change your negative thoughts. But what I did was I applied some of the strategies I was using with the foster children that I was working with, some of the visuals that I was using during their session. And I used that with myself to help me use the cognitive behavioral therapy. Because what cognitive behavioral therapy does is it gets you to stop those irrational negative thoughts in your mind that are creating negative or anxiety provoking emotions. And then it's exhibited through your behavior. And that behavior could be maladaptive. It could be where you don't get out of bed, or you engage in self-injurious behavior, or you isolate yourself into the house. It manifests in many different ways. So I used the signal red, yellow, and green to help me utilize the cognitive behavioral therapy. Red means stop. So when I would get a negative thought inside my head, I would stop whatever I was thinking. And I would yellow, make a choice to replace that with positive self-talk, no matter how small it was. And then green, go, take a deep breath and move forward. And with that, I was able to work through my panic attacks, my anxious feelings, and move on with my life. And I thought, hey, this really works. I'm going to start using it with my clients. And it really is amazing because even clients that come into me now with depression, anxiety, self-injurious behavior, I ask them, I say, what was the most useful tool that I gave you? And 90% say the signal plan. 90%. It's so simplistic, but it works.
Absolutely. Now that's very amazing, Laurie. Going forward, now you talk about depression. Now we all know that depression is rife, especially in this trying and changing time that we are in. Now talking about CBT, how can depression be treated? Applying CBT.
Well, depression, a lot of depression comes from negative self-talk and doubt, and that we are stuck. When an individual comes into my office, what it looks like is I get to know them a little bit, try to get an idea of what's happening in their life. But I also give them data sheets. To me, data is very important because it's journaling, but it's more structured. It's a structured way of journaling. So that data sheet would be A, B, C, the antecedent, the behavior, and the consequence. So an individual is expected to take data on themselves. What is the behavior? I don't care if the behavior was just, I stayed in bed all day. That's a behavior. You're staying in bed all day. And what happened just before you stayed in bed all day? I thought about getting up, but then I thought, why bother? My life is miserable anyway. And then C, what was the consequence of you staying in bed? I felt bad about myself. I thought I wasn't a good person. I felt shame and I stayed in bed. This is all very important information. So then the individual and I will go through that information together so that I can help them use more positive self-talk. I would write a motivational story for them. My name is Laurie. I have the diagnosis of depression, but that doesn't define who I am. I am a person and I want to move forward with my life. I know I can do this. So a motivational story, the signal plan, starting in small baby steps, just to get them to know they're not alone.
Right. Now, talking about therapy, I like to ask you this question. Some of the misconceptions about, therapy, and also I would like you to answer the once again. Is there a must that we see a therapist when we have mental health issues? Because lately I've seen some patients or some of my clients who had mental health issues and they reversed it, not by visiting the doctor, not by taking any medications, but by majorly having a mind shift, and they were able to reverse it. I'd like you to shed more light on this.
Okay, so I want to make sure that I understand what you're asking me. Are you asking me when a client comes in and if they're not on medication? Was that the answer? I mean, yes, the question, I apologize.
Yes, the first question I asked you is, what are some of the misconceptions about therapy when we all directed to see a therapy? What are some of the misconceptions about that? And also I'd like you to address this. If it's really very important for us to see a therapy where we have mental health issues, especially talking about depression, because it's a really big issue. Now, some people will claim that they don't need to take medications or drugs or see a therapist because of a mental health issue. They were able to, reverse this by simply having a mind shift. How possible is this? Do you have any insight to share this?
Yes, well, it's interesting that you say that because I just had a client leave this morning who was prescribed an antidepressant, and she didn't like the way it made her feel, so she wanted to seek therapy. And I explained to her that, we could try it, and I'll write her a treatment plan. We're going to go through the motions, but sometimes people are so depressed or so anxiety ridden that they're not able to utilize the strategies that I'm trying to teach them in our session. So initially, they may need to go on medication just to be able to utilize the strategies that we're viewing. And then we can determine if they can be, weaned off the medication. But let's try it first. That's what I told her. We're going to try the therapy first. If she's able to utilize what we put into place, that's great. And if not, then she'll have to revisit the medication part of it. So I guess that was the answer to your second question. The first part of your question is the misconception about therapy. and my therapy is different. So I'd like to screen people on the phone before they come in to see me, because my therapy isn't where you're just going to come into my office, tell me how you feel, and then you leave. It's very interactive, and we work together, and you're going to have to practice what I put into place, and I'm going to make you accountable. So there's going to be homework. There's going to be things that you have to practice. And it's much different. And I explain that. I think that people are more open to seeing a therapist now, but I will say this, I've had, within the last year, I've had 2 individuals come in and say, I don't have time for the type of therapy that you're asking me to do. Taking data on themselves and making them accountable for practicing their relaxation techniques. It's going to take time out of their day. And if they just want to come in and talk about their problems, then they need to go to another therapist, because my goal is to help train you to get rid of those irrational thoughts and replace them with healthy behaviors.
Right. Thank you so much for that insight, Laurie Singer. Now, going forward, I'd like to talk about emotional distress. Now, that's a very important topic and very dear to my heart. Now, some folks call it mental anguish, mental suffering, or emotional harm. Now, what are the triggers, and when is it appropriate to seek help?
So we got a little bit frozen there, and I apologize. Can you repeat that? Because you froze up.
All right, now I'd like us to talk about emotional distress. That's a very important topic, which is very dear to my heart. Now, some people call it mental anguish, some people call it mental suffering or emotional harm. Be that as it may, I'd like you to tell me what are some of the triggers and when it is important for us to seek help.
Right. Okay. So that is an important question, and people ask that. When our thoughts create those emotions and they're exhibited through behavior, if they become maladaptive in the way that they're affecting our relationships with others, if it's affecting our job, if it's affecting our social life, school, work, then you really need to seek help, because any type of stress, anxiety, depression, it starts to take on a life of its own. And when that happens, it becomes debilitating, and you need to get professional help.
Right. Good to know. So at what points is it important for a person to seek family therapy?
At a point where they feel they are no longer in control of their thoughts that are creating the behavior of them not enjoying life, when they stop themselves from their friendships, when it interferes with their relationships and their jobs, they need to make that call. I had a mom come and see me, a young mom many years ago, and she had agoraphobia, and she would only take her her newborn out at nighttime so that nobody could see her. And she knew that it was a real problem when her daughter ran out of formula and she could not bring herself to go to the store to buy her more. And that's when she came to see me.
Right. Now, Laurie, you are not crazy living with anxiety, obsessions, and fetishes. It's the title of your book. Now, what is this spark, and what are some of the important takeaways you'd like to share with my audience?
Well, the book, it was written with the hope that people could pick it up and read it and find a little bit of themselves maybe in some of the characters. I have 6 different case studies in there, and they all different. Anxiety is in there, OCD, obsessive compulsive behaviors in there, agoraphobia, social anxiety. And along with that, I put in a toolkit in the back, which means that somebody who picks it up will have the data sheets. They will be able to write their own motivational story. There's the visual aids in there. It explains what cognitive behavioral therapy is. It also walks you through what it looks like when you come into my office and what that session would look like. And I also have a chapter of myself explaining how I had some similar situations, with anxiety and how I was able to work through that. And the book, you may not have exactly what that person has, but you would be able to relate to some of those characters. And I think it will help people not feel as alone and isolated, and that there is hope out there.
Absolutely. Absolutely. Thank you for that once again. Thank you, Laurie Singer, for your time on today's show. Laurie, do you have any project in the pipeline you'd like to share with me?
Well, I appreciate you having me on. And I know that we're on different sides of the world right now. And it's just so amazing that we have this in common all around the world. And it's bringing us together and uniting us in a way to help others. It's just amazing to me. It really is.
Sure, indeed. That's the beauty of technology. Great.
Yeah.
So Laurie, do you have any project you would like to share with my audience now? I'll be super excited to listen to that.
Any other projects? I right now I'm trying to help people. I feel like, as you probably know, the waiting list gets longer, and more people are coming to see us. I think more people are able to identify with themselves now that something isn't right, that they need help, which is a good thing, but we also need more people in the profession.
Absolutely. Absolutely. Becoming self-aware is very important, especially when it comes to identifying and knowing your true self-worth. That's amazing.
Right.
Yeah.
Exactly.
Yeah. So any parting line you like to share?
Any what? I apologize. What?
Any parting line or any parting word you like to share with my audience?
No, I just, I want people to realize they're not alone, and there's always hope, and to, give somebody a chance. Also, if you find yourself in a therapy session and it's not a good fit for you, if you're uncomfortable at all, there's other therapists out there. Don't feel like you have to stay with that therapist because you decided to go. I tell my clients, if it's not a good match, that's okay. I won't take it personal. You need to find somebody that's a good fit for you. I think it's very important.
Absolutely. And now that's very important information you share there, Laurie. Your social media handles and your website.
Yes, my website is lauriesingerbehavioral.com or you'renotcrazybook.com.
Great. Good to know that. Thank you, Laurie Singer, once again for your time. I wish you best of luck in all your future endeavors and in your project.
Thank you so much for having me on the show. I really appreciate it.
All right. Really enjoyed your time also once again. If you'd like to catch up any missed episodes of Laurie and Omobola, Stephen, you can do so on any podcast cross-promotion platforms you bump into online. Then you can have an amazing time listening to the show. And also, if you'd like to be a guest on Laurie and Omobola, Stephen, sharing disruptive mindshift conversations on any topic or subjects on the personal development and self-improvement, come on, you can mail me at omobola@outlook.com. Now, I'll be looking forward to having your mail. Come on, we can have a show together. Right. Looking forward to your mail once again. Till I come your way, I need you to stay safe and be good. We are my love. I'll talk to you soon. Bye for now.